And we're back. We are back. We're now moving into our second segment for the morning. And this one, again, like we mentioned earlier, a conversation that we must have. Counseling services, when to seek, and how to find how to ensure that it is the right fit. Now, in with us, we've got Dr. Annel Martinez. She is a psychiatrist. She's in with us. Good morning, doctor.
Good morning.
And how are you guys doing? We are doing great. How are you?
I'm doing fine, thank you.
So let's get on into this conversation. Dr. Martinez, this is definitely a conversation we should have in the household, in the workplace, and everywhere we go, because it is important for mental health. Now, when do we seek counseling? At what point do you recommend that people, you know what? Yeah, let's get to some counseling here.
You should. Very well. So, great question. And generally speaking, when you want to seek counseling is if you notice that you are having difficulties in certain aspects of your life. And this could be academic, relationship, work-wise. Whenever you find that you are struggling with something and it's causing you distress, meaning that you're spending several hours of the day thinking about it, and it's affecting you negatively. It could be something that you're embarrassed about or that is leading you to avoid people or avoid certain spaces, then that's a good time to seek therapy or counseling.
Dr. Martinez, and I'd like to step back a little. Tell us about the importance of counseling.
Very well. So counseling is important. Why? Because it can help you to be able to identify specifically what is provoking your distress, or what is behind your problems, your ways of thinking and your perspective of yourself, of the world. Sometimes you need an objective view and someone who is professionally trained to guide you, to give you insight as to where the problem lies and can guide you as to how to find a solution to it.
Yeah. I think for the most part, Dr. Martinez, I think for the most part, people might not even reckon when something is bothering them. And I like to go there. How do you recognize that something is bothering you?
Indeed. So first of all, the signs that there is something that is bothering you would start with you feel overwhelmed, you become irritable, or you get angry over little things. You find that you're overreacting to situations which you normally would be able to manage. Some people start to lose sleep. Some people have physical complaints, like you get these frequent headaches, you feel this tightness behind your neck, heaviness on your shoulders, you're having aches and pains that you can't explain. So those are usually signs that you are struggling with something, and you probably might need the help of someone else to get through it.
So, times have changed and people are a bit more open, especially in Belize, to be able to access mental health care. Let's talk about how people can do so. And, I guess there are two phases. There's one, exploring, like maybe I'm going to do this thing. And then there's, actually doing it. Let's talk about how to find someone and then taking that deep dive to make contact and make that appointment and show up.
Showing up, I like that.
Yeah.
So to find a counselor or therapist in Belize, first I want to take the opportunity to clarify, because we tend to hear the word counselor, psychologist, psychiatrist, psychotherapist, and people want to know what they do or who does what.
Or what's the difference,
right?
Yeah.
So a counselor, a psychologist, and a psychiatrist can all be psychotherapists. And it depends on their area of focus. So how do you go about finding one? Most counselors and psychotherapists here in Belize have a social media presence. So you can check on Facebook, Instagram, even a Google search looking for counseling/psychologist or psychiatrist in Belize will result in a link to someone here in Belize who offer these services.
Yes.
So depending on what you are struggling with, your first phone call to that office will be, do you handle XYZ? that identify your individual problems.
Yes.
But Dr. Martinez,
And-
there,
Yeah.
sure, go ahead.
And so then whoever works at that office will be able to give you a basic orientation of what is it that they do, how they go about managing their patients, and how you can benefit from their services. Or if they can't, then they can give you the proper referral to whoever they believe can help you with that specific problem. Now we have also psychologists and psychiatrists who work within the hospitals, especially the private institutions in Belize City, Belmopan, Orange Walk, and pretty much all over the country. And there are public hospitals that also have a department for mental health. So in every regional hospital, there's a mental health department.
Yes.
And that is free access for all Belizeans.
So that's the difference between the types of services that you can offer. Now,
Right.
the idea of wanting to see a therapist or wanting to access therapy and then actually doing it, that's a big jump for many people. What's your advice about just getting there? I think that the first fear people have is, I guess, judgment, confidentiality, and definitely looking at the stigma associated.
Right.
So talk about how people can kind of get their mind in the right frame of mind to access
well.
care. Yeah.
So if you see that whatever it is going on in your life is affecting you, is holding you back, is causing you a lot of distress, then you as an individual have to kind of weigh the balance and see, is it more important that I feel better? And even though some people might be judging me or having this harsh reaction towards me seeking that kind of help, or do I want to not seek the help because I want to fit in with people but still be in distress? You have to consider your quality of life. You know, you want to be well so that you can show up in all your relationships and everything that is required of you in your roles in society. So if you have to decide what is more important for you, your well-being or somebody else's opinion.
Yeah.
Okay.
Marlene pointed out something there that folks might not be willing to go to the psychiatrist or getting counseling because they are afraid to get their information dispensed. And I want to know, and I think it's very important for folks to understand, how big is it to at least, even before going to counseling, have a conversation with somebody that you would say, you know what, I trust this person. How big is it in this situation to start to talk to somebody?
Very well. When you find someone who you can trust and who you know is not going to judge you and is going to be empathic in listening to you so that they understand what you're going through, sometimes you can have a counselor who is not a professionally trained counselor. And in most cases, those would be your community leaders, your church leaders, your elders in the community, you know, and you can get good counsel from these people. However, they have their limitations because they are not professionally trained. And so my advice would be use the resources that are available to you.
Yeah.
Talk to an elder in your community. Talk to someone you trust. Talk to someone who's not going to judge you. And if it happens that that person meets their limitations without being able to help you resolve your particular issue, then you should consider. It would be worth considering going to a professionally trained psychotherapist or a counselor. Confidentiality, very important. And all of us who are professionally trained know that confidentiality is first and foremost. Public or private institution, the same values and ethics are shared. Where anybody who comes to you, you are supposed to protect that information. Whatever is shared in our offices is sacred. It never needs to leave the office walls, unless there are few conditions which allow us to breach confidentiality or make confidentiality null and void, which would be if your client's life is in danger, if your client is capable of endangering the life of someone else, if you happen to find out that there is some case of abuse or endangerment, which comes directly to your client, or someone in your client's immediate environment, then we have a obligation to make a formal report, which takes up another legal process. And the client must always be informed before we proceed to do any of this.
So you'll still be informed. The question now, let's say we've thought about it, and I always tell people, accessing therapy or accessing counseling, we have a nagging pain in our body. We try to deal with it on our own. We Google and we go to Dr. Google. We do something, doesn't work. We go to the doctor. And it's the same with mental health issues. You have something that's bothering you, talk to people, you try maybe exercise, meditate, yoga, it doesn't work. And then you go to the professional. Now I've made the appointment. I am brave enough to show up. Or I take the step to show up. How do I know if I'm on the right course? How do I know if this person, this doctor, let's say, and you are a doctor, a psychiatrist, that you are helping me, or maybe I need a second opinion of sorts?
Very well. So it takes a lot of courage for anyone to make that call and then show up. And anybody who has made that step, I applaud you. And for yourself that it's been a hurdle to even get there. So getting to the appointment and seeing if someone is a good fit for you, that will depend on the individual. And you have to meet someone in person before you say, okay, it's a good fit or it's not. You have to look at your level of comfort with that person. Do you feel you can trust that person? Do you feel that the person is understanding what you are trying to express? Is that person keenly listening to what you're saying? And as long as you have these aspects covered, then okay, not a good listener or too quick to jump to conclusion. I feel like I'm being judged. You automatically know that's not the person for you. And you always are free to change counselors if that's the case. If you're not comfortable with someone, then ask for a referral. Be open and honest with your therapist and say, listen, I don't feel like we're making the progress that I was expecting. Your practice does not meet my expectations. Would it be okay for you to refer me to someone else? Or would it be okay for me to go ahead and search for someone else? And no hard feelings there, none.
Dr. Martinez, and one of the things, because I've spoken to people about this a lot, and they would say, I don't want to get any medication for what I'm going through mentally. And I would say, I don't think psychiatrists are supposed to give you any medication. Some, especially if you're certified. Is that the possibility? Is that a case whereby psychiatrists are able to, like yourself, are able to give medication?
Right. So in dealing with emotional disturbances or mental illness, we do talk therapy or we do medical prescription, because psychiatry pretty much looks at the biology behind human behavior and mental illness. And so treating biologically sometimes requires using chemicals like psychiatric medication. And the only person in the list of people, counselors, psychologists, psychotherapists, psychiatrists, who can prescribe is the psychiatrist, because they are medical doctors who specialize in mental health. So those are the only people who can prescribe. If it is a mental illness which is severe, generally it will require some kind of pharmacological treatment or treatment with medication. And if you have started with a counselor or a psychologist, then they will make a referral to the psychiatrist to do medication management for you.
All right.
Not all psychiatrists are trained in talk therapy. It depends on your school of education. Some of us have done introduction into several types of therapy, and some programs will require that you are trained in at least 2 types of therapy before you graduate as a psychiatrist. So those are also questions that the client can ask when calling in, I want therapy, or I have been with a therapist, but now my therapist says I may benefit from medication, so that's what I'm looking for.
Dr. Martinez, let me ask a question here, because that's a key thing. And, getting medication should come from a psychiatrist. How do we know? I mean, in today's world, there are a lot of well-intentioned people out there. How do I know if I'm working with a professional?
Very well. So here in Belize, the Ministry of Health emphasizes that or encourages us to have our qualifications in our offices. And so whenever you get into someone's office, there should be somewhere on the wall where it says, you know, this is my qualifications. I have a master's in, a PhD in, I'm a medical doctor with a specialty in, you know, XYZ. Mm-hmm. And anyone who comes to you for treatment has the right to ask about your qualifications and your area of expertise. Mm-hmm. Because some people come in and they already know exactly what type of counseling they want or what class of therapy they want. Mm-hmm. And so if I come in and I say, I want behavioral therapy or I want interpersonal therapy, then whoever your provider is should be trained in that specific type of therapy. Yeah. And again, public, don't be afraid to ask about qualification, because if you are seeking the service, you want to ensure that you are getting exactly what you need. There is no regulatory body per se in Belize which says who can practice under what jurisdiction and any limitation to their practice. Mm-hmm. We're not there yet. And I know a few of my colleagues, psychologists, who are working towards that to regulate who practices, how much credit hours you must have to be able to practice. Because most people who are trained must have not just an undergraduate degree, there's usually 2 to 3 year postgraduate studies involved. And you must have at least 300 to 350 practice hours before you can be licensed to practice.
Wow.
Yeah.
Wow.
Yeah. Well, that would be helpful. But you said something, and I want to dive into it deeper, because as we look at international news, I know a lot of people follow what's happening with the royals. People are now talking about EDMR therapy, and you've said it quite a few times that there are different types of therapy that people can access. Tell us about that, and you know, how do I, if I don't know anything, I just know I want to feel better. Yeah. I don't want to be down, upset, angry, frustrated, you know, whatever it is, depressed, anxious. I don't want to feel that way, but I don't know what I need. How do I know what type of therapy I should be looking for?
Very well. So generally when you have your initial intake, your first consultation, then your provider looks at type of personality, how practical you are, what your underlying problems might be, if there is any traumatic event which is holding you back from progressing in life. And so it depends on your primary assessment will determine, okay, this person will do better with trauma-focused therapy. This person can benefit from dialectical therapy. This person can benefit from cognitive behavioral therapy. Mm-hmm. And most frequently now we see that people are using more of the cognitive behavioral therapy.
Can you break that down for us?
Cognitive behavioral therapy, the concept behind it is that your behaviors are influenced by your emotions and your emotions are influenced by your thoughts. And so we dive deep into the way you think about things, which makes you behave the way you do. Let's say, for example, you're in the grocery store and you pass a person you know from a distance. They don't see you, they don't say hi. But it also happens that maybe the week before you had texted that same person and they left your message in seen and didn't answer.
Happens a lot.
They don't say hi. Mm-hmm. And you go thinking, what did I do? Are we in a fight? Why are they not talking to me? Why did she not acknowledge me? You know? And you have made that up on your own. The reality is you were in the grocery store, you didn't say hi, she didn't see you, nothing happened. You sent a message, it was seen, never responded. It could have been that the person was busy. It could have been that they overlooked it, you know? So many factors could be behind that. But you, from your own experience, draw your own conclusion, and from your conclusion, from your behavior. Mm-hmm. You don't call back. You don't say hi the next time you see her. You never talk to her again, right? Mm-hmm.
Yeah.
So when you go to therapy, we look at, okay, what's the relationship like with that person? What's the reason behind that person avoiding you? Is there any valid reason or substantial amount of evidence to support what you are telling yourself?
And why do you allow your mind to move automatically in that direction versus maybe having a more rational, or
Right.
I guess, I don't want to say rational, but you know what I mean, rather than maybe seeing it from a broader perspective.
Yeah.
I used to have a professor who said, the psychological is never logical.
Okay, my logical brain can't. But it's okay. So let's move just one step further, because we do have to wrap it up, and it's been so insightful. What's the difference that can be made? I once heard one therapist say right here on the show, said, you know, if you're an athlete and you want to train, you go to a coach and they train you.
Right.
And very often, sometimes when you go to a therapist, you are getting life coaching in itself, tips and training the mind to be able to cope better. What is the
Right.
difference that you see in clients, whether they come for short-term therapy or long-term therapy? What's the change in quality of life?
So for someone to decide how long they want to be in therapy, it'll depend on what is going on when you enter into therapy. Some people will find that it's just one isolated event or experience that is happening to them that they can't get past. And those people would come in for what we call counseling, which is a short-term psychotherapy. And we tackle that one particular problem. And as long as you're over that problem, you could carry on with the rest of your life, that's fine. So how do you assess that that's the only thing? Your family life is okay, your relationships are right, work is going fine, your relationship with yourself is good, you don't need long-term therapy.
No.
However, if there have been multiple issues which brought you to your condition now, like in the case of anxiety, depression, post-traumatic stress disorder, etc., then we anticipate that there will be a longer-term therapy. Some people are in therapy for all their lives, and they come in occasionally, like whenever a problem pops up, they come in for several sessions, and then they go about their lives again. Something else comes up, they come in again, and you can do therapy that way.
Okay.
Most people nowadays, we want quick fix. And so we come in and we want I will come in for 8 sessions, then after the 8 sessions, I should be fine and I never have to see you again. That can also be arranged. It does not guarantee that you're not going to run into some other hiccup somewhere down the line, right?
Yeah.
But we can commit to doing the 8 to 12 sessions, and then we see how it goes.
Okay.
All right. And finally for me, Dr. Martinez, now in today's day and age, like Marlene had mentioned earlier in the show, we noticed that people are actually speaking up. People are actually trying their best to try and get the services they need. Is that the right case? Is that the situation as we speak? Or people are actually holding back? What are we seeing?
They're seeking help. And I think as unfortunate as it is that we had to experience, or we're still experiencing the effects of a pandemic, that drove a lot of focus to mental health, and mental health was at the forefront right next to physical health. Because this was a traumatic experience for everyone. A lot of our lives were turned upside down. And so because the professionals or the key speakers as it came to the pandemic put an emphasis on mental health has actually come to the forefront, not just for the people who are affected by the pandemic, but people who are dealing with mental health issues way before that. They feel safer to look for it because now it seems more popular. And especially in the younger generation, I see that a lot of teens and younger adults are coming and seeking help. The older people are the ones who are less likely to come in. Men are even less likely to come in as opposed to women, because that's how men are with health in general. Yeah. They think they can manage until they can't. And so therapy is not for any specific group of people. Therapy is for everybody. And full disclosure, I used to be in therapy myself. It was a requirement of my training to be able to sit in the patient's chair, so that I know what it feels like to be there when I am dealing with my own clients.
Yeah.
And I would say my therapy was very fruitful. It was very insightful for me to do all of that introspection and learn more about myself. And that is a part of why I have been able to maintain my own stability, because my job entails carrying a lot of other people's stuff. And so it's healthy for me to also have somewhere where I offload.
Yeah.
And so therapy offered that for me.
Fantastic.
Wow. Dr. Annel Martinez, they say
Belizean
Yeah,
psychiatrist.
Belizean
Thank
psychiatrist.
you so much for
Thank you.
joining us.
Yeah, thank you for joining us this morning. Here's to wishing you all the very best. Do enjoy your day.
Thank you very much. You guys too.
All
All
right.
right. We're about to take a break, but when we come back, we'll be discussing an MOU for tracking data for commercial vessels that was signed by Oceania Belize. And you might be wondering, why is that important? I'll tell you when we come back.